on. So this is our agenda for the day. You have a copy at your table perhaps as well, but we have speakers from pediatrics, the Vaccine Preventable Disease Control Program and its interface with pharmacy, as well as Father Mark Menegatti from the Archdiocese of Los Angeles. We do have some exhibitors outside, so during the breaks, please take a chance to go and speak with them. They're all very kind, very collegial, and really just want to help us all with our main mission of improving vaccination rates and vaccine access. And then the last thing on the agenda, really special, will be for the first time presenting our Vaccine Provider of Excellence Awards. So most of you, I think, are aware of ICLAC and who we are and what we do. Our mission and vision are here. But what I really want to focus on today is our recent development as an independent 501c3 organization. So for most of our 25 plus year history, we have been a project of the Los Angeles County Department of Public Health. And we are now striking out on our own, but of course, maintaining a really close connection and ongoing partnership with public health as well. What we do are a number of different things. Our kind of bread and butter items, though, are convening these general session or vaccine forum meetings. We also distribute information through our newsletters, which are now on a quarterly basis. So if you're not subscribed to our mailing list, you can put your information in on our website, which is immunizelac.org, and you can start to receive those things. And then we also do implement grant-funded projects, which will be a big focus for us now that we are a 501c3 organization as well. Just as a kind of blanket statement, our speakers today have no conflicts of interest. And it's now my pleasure to introduce our first speaker, Dr. Ilan Shapiro. Dr. Ilan Shapiro is the Senior Vice President and Chief Health Correspondent and Medical Affairs Officer for AltaMed Health Services. He supports strategies for external health communications, advocacy, and community relations. As the Chief Health Correspondent for AltaMed, Dr. Shapiro works closely with public affairs, community affairs, government relations, and civic engagement departments to expand community health and wellness initiatives. Please help me welcome Dr. Ilan Shapiro.
I have this because my kids do not believe that actually I do. Then it's actually, yes, this actually proved my kids that I not just travel, I actually do other stuff. Thank you so much for being here. And a couple of things. I had a couple of conversations with you in the past hour that I was here, and the frustration is there. The fear of the things that we are at, the moment where, like, people questioning if hepatitis B is a bad virus, questioning if, like, all these things like, oh, whooping cough, oh, it's a simple cough, and things that we have never had in front of us is a true reality that it's our true reality of the things that we have as a community. We are, for everybody online, I'm so sorry. I'm not going to restart, but it is. Then we have a lot of things to actually do that part. We already talked about who am I. I'm a practicing general pediatrician. I have been with the community for the past 20 years. And I serve in AltaMed. We have around 600,000 patients, probably around 150,000 are kids. For me, vaccines is kind of the cornerstone of a lot of things that, we are not seeing. And what do I mean with this? Because I had the opportunity to practice in Mexico. And I did CPR in dying kids with whooping cough. I needed to do so many LPs, lumbar punctures, to actually figure out if it was a viral infection or a bacterial infection. And I saw the devastation when communities that didn't have access to vaccines, or for whatever reason they were not up to date, how that opportunity to save and just be worried about an exam or a soccer game goes to survival mode. Then that's where I'm coming from. And we all have, and I have a couple of disclosures for you. And I'm going to do this one. This is actually my real team. That's why I wake up. Those are my kids, the ones that I'm doing the pictures for, and making sure that like whenever I touch a patient, whenever I go out on the community, I'm reminded about one thing, that no matter if you play for the red team, the blue team, or the purple team, most of us actually do believe that kids deserve better. They need to be protected. They need to have that part. And that feeling is something that it's real, and we all have it inside of us. And one of the interesting parts that we have right now is that whenever all of us are involved in a way or another on the vaccine part of it, right? And we are all frustrated with all these things. We do not believe, we see the numbers, we see the science, we actually see sometimes even the clinical outcomes of bad outcomes of what's happening. Talk about Texas, talk right now about what we're seeing, whooping cough. There's some cases of chickenpox here in LA. Then we're starting to have stuff that we have not seen before. And we wonder, like, all the science, you look at the journals, look at absolutely everything that it's out there. It's simple, it's logic. It's like math, 1 plus 1 is actually equals 2, and there's a logic to it in our brains. But we are forgetting the centerpiece here. What's actually the journey of our communities? What's actually the journey of what they are experiencing? Because numbers don't lie, it's logic, it's real, it's for all of us. But what ends up happening, and see if actually, yes, we have this part. Then before they come to us in our clinics, before they actually start interacting with any part of the healthcare system, they are already fighting the social media algorithm. And we love the jokes and we love the dancing, but if you scroll down and you go like, oh, be careful, it will actually give you cancer. Oh, be careful with this. And by the way, subscribe for $200 a month for these amazing supplements. Then we have all these things that are happening in social media, and it's a reality. Are we there? All of us there? No, we're not. Are we trying to get there? Yes. The other conversations, like we have heard about Joe Rogan. And don't get me wrong, I love his podcast. It's funny. Has really interesting things, but when he starts going to the healthcare aspect of it, he's selling what people want to hear and engage. And there's no filters or counterparts for that conversation. Then our family that is coming to your clinic already is hearing that message. And they are viral, they're interesting. There's 2-3 hours of podcast. I have no idea who actually has time to sit down and hear this podcast, but it happens. And the other thing is, you have daily life experiences. I got my influenza vaccine and I got sick 3 weeks after. The vaccine didn't work. That's actually something, or, like my, and we all probably heard it, like the cousin of the removed friend that was divorced got the COVID-19 vaccine and had X, Y, and Z, and that's why I decided not to do it. Then you have all these things around our things, and of course, what we see in TV, because a lot of the communities, especially for minorities, apart from using the social media algorithm, they're still involved with ethnic media. Univision, Telemundo, our Korean channels, our Vietnamese channels, our Mandarin channels, like all these languages and things, they actually perceiving that part. And a lot of the times there's no counter reaction. They are not as good as we have. And that's actually the fight that we all have, even before they come to see us. And look at all the opportunities that we have inside of our systems. And I'm going to actually talk more about our nurses because I think that we are failing them. The first part is actually the clinicians. Yeah, we all know that part. We're still nurses, doctors, teachers are still one of the most trusted voices that we have in the community. We know that part. Are we using that voice? Are we empowering the doctors to have that conversation? Because I don't know about all of you, but in my old days, my pediatrician will go like, this is a preset menu, and you're going to do it. There was no question, do you like it? You don't like it? Do you want to do something about it? Do you prefer bread, blue? Nah. That was it. Right now, things are changing, and we're not giving the tools because us as, and I will actually bulk here, any healthcare provider, we're trained to save lives. We're trained to do so many procedures, even coding and EHR and all the stuff that we do, but we're not trained that much on how to perceive and have conversations. And it's changing. Because remember, all of us are frustrated. We know the numbers, we know everything else. The science is clear. Why are you not deciding? Well, this is why, because all the things that we have here are against our patients, our families, our communities, in a good way and a bad way. And we have opportunities around our clinics to actually start those conversations. And this is the good news. I know it was depressing, the first part of this, but the important thing here is that we are still here. If we ask our patients, who do you trust most? It's still healthcare providers. It's not the influencer. It's actually the expert that it's in front of them, that it's creating that engagement. Will they follow all the things that we recommend? I just don't know. It's case by case. I'm not going to give you the dream. I'm not going to give you the solution or the special potion to resolve absolutely everything. But it's a good start of the things that we have in front of us. Then right now we are living in a trust paradox. And I'm giving you all this information because after in the middle, I will actually give you some ideas of how to start this, because we have had a lot of failures during COVID-19. And I'm not talking about the science. I'm not talking about the vaccines, because those actually save millions of lives, save complications. We all have our scars and battle scars regarding COVID-19, but it's important to figure out this part, and especially the misinformation part of it. There's disinformation, malinformation, misinformation, but let's bulk all of them. It's actually information that will give us headaches and our patients fear. And we need to figure out how are we going to create a treatment, a cure against fear with a dose of truth. And that's the job that we all have here. How can we start creating that part? And most importantly, make sure that the vacuum of silence is gone. I'm going to give you an example. Your partner comes late, smells like some liqueur aroma coming from the mouth. And suddenly you request some information and they go like, where were you? Oh, that silence is horrible, right? That silence is horrible. That's a vacuum of silence that we actually created every time that something actually changes in our communities. We need to be out there and explain how science works, where we are, what we know, and what we do not know. And I know our egos sometimes are like a little bit amplified, but we need to actually be bluntly honest with what we know and what we do not know, and give back that engagement to our parents, our families, and everybody that we have around us. And this actually happens in different ways, because at the moment that all our patients, our families, and even us, we start having the public health, the public actually narrative. We're trapped on those conversations. We're trying to actually to figure out where we are. And at the end of the day, you have a choice to choose between doing a procedure, and I'm talking right now, a medical procedure for your kid. And I'm going to go with one of the most trending topics right now about hepatitis B. Like, why, and if you just put it like this, why the hell you're actually vaccinating a newborn that has like a couple of minutes of life or hours and you're actually giving a vaccine? Is there logic to it? Because I heard that hepatitis B is actually, and I'm going to be, the hepatitis B is actually just sexually transmitted. Are they going to have a party in the first 24 hours? Are they going to do all these things? Then they start actually having this circle of things. And at the end of the day, all our healthcare providers need to actually answer this in a good way that can open the conversation. And by the way, I'm not, and you will hear me say this, when I see a patient, and this is part of actually what happens inside of the exam room, this is one of the first tips that I'm going to give you. When my patients, I'm in front of them and I tell them, I'm not your coach, I'm not your judge, I'm not even the goalkeeper or anything. I'm actually your waiter. I'm actually here to show you the menu and give you the choices that we have today. I will tell you what are the best things that I can actually offer. What are my favorite dishes? What we have in specials, like sometimes it's the special of influenza or COVID-19 when it's September, October-ish. And right now we are done with RSV opportunities because it's off season. But we have other stuff and you can tell me, well, I'm deadly allergic to this. Well, tell me about it, or I have questions. And that way it changes the whole dynamic. Why? Because me as a healthcare provider, I'm actually bringing the opportunities of a patient that has not been empowered, that feels jaded, that the system is against them, that they have been lied to. I am seeing, why should I do the hepatitis B vaccine? Then you start the conversation a different way. You're opening doors. And also me as a provider or a nurse, I'm not fighting the fight of, I need to give the vaccine. Yeah, of course, we know that we want them to be protected. That's one of our best dishes that we have. But at the same time, it helps me not to burn out because it's something that we're seeing here. And this is where the data versus story starts actually figuring it out. I told you about that we know about the data. We know about absolutely everything that is happening. We understand right now the stories, and storytelling inside of the clinics with your nurses. And I'm going to emphasize on this one because if you think that me as a doctor, I'm suffering every time that I hear about vaccines or I have a conversation, I'm there 15 minutes to half an hour. My nurses, my MAs, my LBNs are there with them longer than that. And they are the ones that are actually creating that part. My front desk also, like with the papers and stuff like that, why not give a QR code with information about vaccines? Why not actually train our nurses not to get that burning sensation of yelling with their heart, like I cannot answer this question again and again and again, or give them the tools on how to present that menu. Then that's where the data and also the stories start actually putting the counterbalance. And we need to have that part. And that's why one of the most interesting things that we have is that we have all tried to do the classic way, right? We remember the polio vaccinations. I was part of and we still do it in Mexico, the drops from the polio vaccine. I over-vaccinated, and I say over because I went over again and again every year to communities that didn't have access. And we have that story, but that's actually just using two important parts, our nurses and our doctors. But right now we need to think about our amazing dentists, our community health workers, our behavioral health clinicians. We're wasting time and energy and tactics if we have integrated systems or people that live around us to actually do all of these things. And we started something called White Code for Change in Altamed. And I'm going to give you a small commercial on that one because I had the idea that, like we're all frustrated here inside of the clinics, but rarely we unite the people that make a difference. The real integration of healthcare, the real integration of bringing those stories to the community to pre-bunk and debunk information. Pre-bunk is, like we know right now, if ACIP is talking about X, Y, and Z, we know that there will be some waves. And debunk right now, for example, hepatitis B, yes, it could be a sexually transmitted disease, but also at the same time, you can guarantee the mom is completely free. But what about the uncle? What about grandma? What about the daycare? Can you guarantee that them are hepatitis B free? Could you ask? Is it okay? Then you start actually creating those conversations. Then with White Course for Change it's creating that feeling inside of the clinic and most importantly outside of the clinic that we can empower our providers to do something. And we know already the reality that we have here. The reality is that, more and more that shield that we had, I'm not even calling it a barrier. I'm not calling that the whatever we call it. It's actually that shield that we had, it's actually being destroyed. It's a reality. And you know what? I'm actually not worried about 2026, but let me tell you about 2028. Let me tell you about 2035. The pediatricians and physicians that we have today and nurses and everybody else have never seen this. And I'm talking about whooping cough because it was very easy, like, oh, it's not runny nose, oh, cold, Tylenol, may God bless you. That is changing right now. Because we have always considered, for example, whooping cough and will actually go up. But if you actually see the symptoms from whooping cough and measles at the beginning, they are quite similar. And catching them earlier can make a huge difference in both cases. Then trying to figure out how are we going to be doing that part is extremely important. And part of the conversations that we have is that when they come to you and they ask you something and they actually, I don't want that vaccine, I don't want that procedure, that's actually the face value of what you're seeing. You're actually not seeing the drivers behind them. And I'm telling you this because we need to pause right now and reflect. How much of our own frustration, burnout, and everything else is actually not helping us reach this? Okay. If anybody wants to shout the answer for this one, what's the number one barrier to have these conversations in any place? Come on, anything. I will do the awkward silence. Anybody? For 100 Americans, yes, that was the one. Yes, that's the one. Time. And when I was like that, like, no, you don't want to vaccinate, I don't have time. I will give you 2 videos, some QR codes, may God bless you. I changed that. Let me tell you why. Because the investment of staying there for 5 to 10 more minutes, opening the door, and I will show you like a method that we can actually do that part. It's an investment not only for me as a pediatrician on the next round, it's actually a benefit for the parents because they are not feeling dismissed. Because they already know that most of the pediatricians, because that's what Instagram tells them, or TikTok, we don't care. And if they want to actually not vaccinate, we will kick them out and they will need to go to their favorite chiropractor or naturopathic provider. And they don't vaccinate, then they are okay with it. But if we start actually creating that space where we're understanding that part and we spend a little bit more of time, and yes, it will take time, and yes, I will be half an hour late, and probably I will have the conversation with my kids of why I was late. But at the end of the day, this is an investment for all of these things, especially right now that before CDC was something that we loved. And right now, there's still great people working there, but it's different. Do I hear about the American Academy of Pediatrics? Where do I go for that institutional knowledge that I used to have before? And this is something that you need to commit to your heart. And on purpose, I actually use this word. I rarely use it, but the idea of this is actually what's where is your patient in front of you? Where's your community that you're serving? And usually, like accepting green, you're good. It's part of it. Make sure that you're informed. We're not on the time that we will just commit and move away from this. You need to make sure that you're giving some cookies and brownies. That way they can come back afterwards. Strongly resistant, you need to continue opening the door. Do not dismiss them. I prefer them coming with me 400 times and them saying no, and they are comfortable saying no to me, than actually sending them to the jungle and figure out how are they going to survive. Then we need to start, because in the old days it was very easy, like, oh, you don't want to? Enjoy, please switch providers. That's the door. And people would do that. And people are still, depending on where they are. And of course, like, for example, for my non-vaccinated patients, I try to actually not have them on peak hours, make sure that they understand that they're putting at risk my newborn babies, that I, they have less slots actually for them. And, I explain them why I'm doing things to actually help them with that part. And of course, hesitant parents. And in reality, it's humans like you and me that have questions, human beings like us that have seen stuff, and they want to make sure that they're doing the best decision for their kids. And not doing it, being neutral is usually not the answer. Then you need to commit to one side or the other. And there's things that we can actually start changing on the way that we're talking with our providers and our patients. Don't be afraid of actually having confident language. A lot of the times we are just moving forward with things, with ideas. Using confident language actually makes a difference. Like, this is the menu that I'm going to offer you today. These are the options. And of course, like, explain absolutely everything. Because if you start like, I'm going to give you an example, and sorry, Christian, I'm going to use you over here. I want Christian to be my best friend, right? But I go like, Christian, would you play with me? Exactly. Thank you, Christian. Thank you. Even better than I thought. Then that's the idea. You need to be present and doing a part. If he wants to play, yes. If not, no. But I'm the first barrier. I'm the first problem that they are actually encountering. And I hope that it works. And this actually, let's see if can make it happen. It is what it is. But the important thing here is that creating campaigns and ideas that are actually going back to your community are so important. This is something that we created in Altamed on Ándale que Esperas, and actually we shared it with a lot of other community clinics. And the idea was for all non-Mexican speakers, and that's on the cultural side. El Chavo is kind of like the hero of a lot of us when we were growing up. It actually, when all Caribbean, most of every country in Latin America actually knew about it, and we actually had the opportunity to create a cartoon to talk about vaccines, about why they would need it, and bringing it, leveling up the cultural and linguistic component of it to make sure that our communities were safe. I'm going to start like summing up right now. We have 2 hours more, right? On that part. Then I think that the slide deck is all yours. It will be floating somewhere in the world, but these actual examples of COVID-19 that we used with something that was part of this, our shot of Vacúnate Ya. And the idea is actually, it's very simple. You start with a conversation, you have your key messages, and you end up with a conversation. And here, the important things that I want you to actually understand is that we're very commonly known as people that do not hear. We ask a question, we don't hear the answer. We need to pause and hear and reflect what they're telling us. And yes, we feel that it takes 2 hours, and no, it's like 1 minute. It's 30 seconds. It's not like, what's your name? Juanita? Ah, Juanita. No. Wait, hear the last name. Hear if there's anything else that they actually have. Make sure that you're creating alignment and find common goals. For me, for example, with vaccines, I tell them about my kids. I have 2 kids. I cried every time that they got their vaccines on the first year of life, not because they're good or bad, but I didn't want my kids to cry. I didn't want to do that part. And I understand the frustration that you are having as a parent at the moment that your kids are in front of me. And I will make sure that I will make everything that I have in my power, my secret potions, and absolutely all the magic that I have to make sure that this is the best experience that we can have it. And also, the key messages, like there's things that are real, and I want you to actually read this one. Side effects are common. And the parents will go like, oh my God, side effects. Why should, yeah, they probably will get like some fever. They probably get some like pain on the arm, some redness, probably like, hard to move it the next day. Probably it's one of my favorite ones that we don't talk about that much. It's actually, they probably will sleep a little bit better. Then you talk about that part and you make it good and you answer the questions. And of course, no matter what they want to do at the end, you leave the door open. Because again, you want them to go back to you and not go back to somewhere else. Then it's hard, 100%. And these are some other examples for that part. And regarding COVID-19, it will be there. But we need to start actually deploying the filters. There's a lot of things. And the reality is that, yes, there are common side effects, but, they are weird. The other thing is, what are your options? Like right now, the New York Times article regarding the mom that her little daughter had measles when she was, very young to be vaccinated and died 11 years afterwards for the brain swelling that we had. Then talking about that part, that they are not simple things, and it's like you're hearing that you feel right now protected because you're not doing anything, but that doesn't mean that that's real safety. Then trying to create those conversations are extremely important. Always start with shared values. Make sure that you're telling them the fact. Okay? The strongest evidence shows vaccines do not cause autism. Example, that we probably hear it every day. You can actually choose to do this one. And of course, this is the choices that you have. And the same way that not choosing will also bring other stuff, give the other part. If you don't choose right now, probably will be fine the next couple of months. But right now, if there's measles or someone in your house actually gets whooping cough, your kid can have it and gets complicated. Then having those conversations are actually going to work amazingly well. And I love motivational interviewing. Those are tools that we need to give to our nurses first and our doctors second. Our doctors should be kind of the people that will have the opportunity to go more in the data part, but don't forget our nurses, our community health workers, our even dentists, our behavioral health clinicians, because all of them are actually having that part. And it's very important to understand the questions that our community will have. Why, what's your worry? Remember the iceberg that we had? Like, go deep. It's worth it. And I promise you, it's not going to be a lecture of 2 hours to actually do this part of this part. I ask you, because we did this part a couple, on my brain, make sure that you create that work group of how to train your own, create your own white coats for change teams. We need it right now. Trust me, it's the best thing for our community because they need the information, but also for your teams, your nurses, your behavioral health clinicians, your community health workers, your doctors. And of course, and I will leave this algorithm. It's something that it's a combination between the CDC, what the American Academy of Pediatrics is saying on how to actually figure out that part and deploy information for our community. And this is actually extremely important. With this, I will actually finish 1 minute before time. Parents, remember what's your tone, not just the statistics. The welcoming part of the healthcare system right now should be, and especially right now with everything that's happening, all the noise that's happening outside of this room, should be welcoming. our parents deserve a space because they are, at least on the patients that I serve, they have 2 or 3 jobs. They have such an amazing pressure to actually bring food, do the minimal things, pay rent. I want to be a helper to make sure that they are creating this space as much as we can and make them happy. I'm going to leave this on the last slide of the presentation because it's a summary of all the stuff that we did today. We started, like lead with what's the expectation and actually move around, listen, acknowledge, respond. And after that, some closing statements on what should be done and recommended. And this is actually one model of 400 billion that we have out there, but this is the one that I like the most. And at the end of the day, if we're not together in this one, I promise you that in 2028, we'll start having more rotavirus. Who has worked in a rotavirus center or a rotavirus? Okay, we don't have them. Why? Because we have a vaccine. In my old days, we had, because it's very contagious, we actually have a floor in pediatrics only devoted for that one. Then you can actually smell the poop. You can actually see the kids' dehydration, everything else that you were seeing. Things that probably will start coming up. Right now, most of the PQs are going because thanks to vaccines and a lot of the modern stuff that we have, we're not using them. Probably we will need to retrofit them and actually start having more. Then and also, all the neurological complications, heart problems, hearing problems, and so forth. Then I know that it's very depressing, but right now we do have the opportunity because we have time to do something. And it's all about the conversation. The science is there, but how can we deliver the information to our parents to offer them a choice? That's our new and most important thing. That's my real QR code. If you want to send me messages or anything like that, please do so. Always here. If you want to hear more about White Coast for Change, what we're doing in Ultimate, let me know. And thank you so much for the opportunity. And I hope that you enjoyed it a little bit. Do we have time for questions and answers? Do we have anybody online that we can see if they have questions or no? No, nobody online. Perfect. Thank you. Very, very clear, my thing here. Any questions, ideas, suggestions? We're saved.
Thank you so much. Thank you, Dr. Shapiro. Right, so we'll go right into our next presentation, and then afterward we'll have a break. So this will be a joint presentation, Dr. Sherry Sherman and John Shea. I actually have them flipped, so I believe John will be speaking first. John is a supervisor for the Vaccine for Children's program in Los Angeles County and the California Department of Public Health. Thank you so much for being here. Oh, and actually, I'll go ahead and read Sherry's too, because I don't want to come up in the middle. I'm sorry. And then Sherry Sherman is a strategic and seasoned leader of high growth organizations, including pharmacy services. Sherry owns Elements Pharmacy, a community-based specialty pharmacy specializing in preventative care, including vaccinations, point of care testing and treatment, travel health, and executing on the expanding role of pharmacists, including through collaborative practice agreements. Starting as a de novo pharmacy in 2016, Sherry has been quick to pivot in response to community needs. So thank you both.
Good morning, everyone. You can hear me, right? Okay, I'm not going to move around like Dr. Shapiro, so I'll be right here. And that was a great presentation. Thank you so much for that. So my name is John Che, one of the supervisors here in LA County for the Vaccines for Children program. I've been doing this for as long as I remember, probably started in 2000. So it's been like 26 years. So I've seen it all, heard it all. And I just want to say thank you to all the hard work you guys are doing out there. It's really great to see what we're all doing in the immunization field. But today I'm going to talk about the VFC pharmacy pilot program. It's still ongoing, just so you know. It started since 2022-ish. So it's still an ongoing process. I'm just going to kind of talk about it for your information. Oh, any pharmacies here? Any pharmacists or pharmacies? Okay. So what did we want to accomplish? What were our goals coming out of this? And I'm just going to kind of read off what's written on here. So it's how can we learn with pharmacy enrollment in VFC? How can it assist with the expansion of the VFC network in key geographic areas of California? I'm going to talk about the key geographic areas in the next slide. It's very specific, so I'll talk about the next slide. We also wanted to see, we want to leverage the pharmacy's expertise in vaccinations during the COVID-19 pandemic, how it's going to quickly reach vulnerable Medi-Cal and VFC eligible children outside the existing provider network. So you got to think this is 2022, right? COVID hit in March of 2020, huge ordeal. And then pharmacies were really an integral part of getting the vaccines out, immunizing patients. So this is 2022. And that's where you said, hey, VFC, what are we going to do to expand our program, get children immunized? So that's where this came up. And then when you think about the Medi-Cal patients, so they're usually part of a HMO, right? So they have to go to a specific provider. They can't just jump around. If they do, then the providers don't get reimbursed. So we're trying to partner up, work with Medi-Cal, work with pharmacies, work with providers. What do we do so that the children get protected for getting vaccines? And lastly, how do we do better as VFC program? How do we open up more partners? And one way is obviously with the pharmacies. So that's what we're trying to do, learn more about this through this pharmacy pilot program. Okay. So obviously we can't just enroll any pharmacies that wanted to join. We had to kind of have criteria because we didn't want like 500 joining at once. So what we kind of looked at was, again, the key geographic areas. And we wanted the pharmacies to be in zip codes that ranked in the 2 lowest quartiles of California's Healthy Places Index. So HPI 1, HPI 2. I'm not going to really go into that, but I think there was a website, sorry. Okay, so if you want to go check the website, so they're kind of looking at the social and economic status of each zip code, each neighborhood. It's www.healthyplacesindex.org. So if you guys want information, please go there. And again, this is 2022. So if you remember, all the pharmacies, they had to go through My CAVAX, right? I think some of you are familiar with it. Caused a lot of headaches, I'm sure, but hey, that's how we had to do it. So from the back end, VFC could see who was giving it, who was ordering it, what was being administered, what was being inside, what was not being administered. So we definitely wanted pharmacies who were giving vaccines out. And then we also wanted to focus on the independent community partners, community pharmacies, because we didn't want like CVS and Walgreens. We wanted like the pharmacies within the neighborhood so they can go to it, they'll feel comfortable with. So these are kind of the criteria that we're looking at. And minimally, all the pharmacies, what they had to do is give flu. They just had to order flu and give flu. All right, we have all the ACIP vaccines, but that was the minimum. If you order flu, give flu, we're good with that. Okay, so after all that, I want to say VFC identified about a little over 120 providers or 120 pharmacies. Emails were sent to them saying, hey, let's join. And in order to kind of introduce the program, VFC did several webinars for them. So basically to introduce our program, recruit providers, and explain VFC what it's all about to the pharmacies. Obviously, we have certain criteria they have to meet. You just can't put vaccines in the fridge, like it has to be properly stored. So, and we have eligibility criteria. They have to be they have to meet certain criteria to get the vaccines. And again, storage units, we have digital data logger requirements, and obviously you have to report to CARE. Okay, CARE is a California Organization Registry Program. Okay. Also during the webinars, we talked about the benefits, reimbursed for Medi-Cal. That was huge, right? Getting them to reimburse for vaccines administered, cost savings. So VFC, you don't have to pay for it up front. You order what you want. You think you're going to see this many patients. I need this many vaccines, and we'll send it to you. So that's huge cost savings for them, and obviously increased opportunities for administering vaccines. VFC is huge on missed opportunities, right? We never want missed opportunities because if they're there, let's give them 1, 2, 3, 4 shots, whatever they need. We don't want to give one, hey, come back later, and they don't show up. So this was another thing where pharmacies can help us. And obviously simultaneous administrations goes along with that. Okay, and again, minimally just order flu vaccines, even though we have all the ACIP vaccines. And if they wanted it, they can order that as well. So after some of the pharmacies were enrolled, VFC held some roundtables, specifically in September 2024 and March of 2025. This was a collaboration between VFC and DHCS with the Pharmacies Benefit Division. This is the Department of Healthcare Services, basically to talk about what's working, what's not working, how do we do better, how do we help? So it was just like an open forum. I believe Dr. Sherman was on there as well. Right? And it just basically allowed pharmacies to talk. There's probably going to be more that they want to do in the future, but then this is all just kind of it's still a work in progress. Okay. And I also mentioned that there are over 120 providers that we sent email to. When I say providers, I mean pharmacies. Okay. And some of them, we got no responses. Like, was it too hard, requirements too not favorable, like what was going on? So we try to ask them for feedback as well. So again, this is what the pilot was all about. Okay. This one, so we have an at a glance. So this is for pharmacies who want to know, how do you be successful in VFC? So this shows everything what you need to be doing, being compliant with VFC. VFC does do site visits, so we want to make sure that the pharmacies are meeting all requirements. There is a website, it doesn't look like it was there, but it's on easyIZ.org /resources/pharmacy/pilot. So if you got that, there, that's where it is. Okay. If not, I can email you a copy as well. Okay. So of the 123 in California, currently there's 30 pharmacies enrolled. This is across the state, San Diego, Sacramento, and so on. There's 10 in LA. We had 12, 2 disenrolled. So 10 pharmacies are enrolled in VFC. They're giving vaccines. Like I said, they're ordering minimal flu. Some are ordering all of it, and just remember, we also have live vaccines which need to be frozen. So in LA, 10 pharmacies. And then I kind of mentioned this is still a pilot in progress. So we're still trying to figure out what's the best way to enroll more pharmacies. We do want to do another launch, but they haven't decided when. But we're looking at the HP1s, HP2s, HPI1s and HPI2s. So maybe next is going to HPI3s. So that's the Healthy Places Index criteria. So a lot of things that have been going on with this pilot project. So that's where we are right now. I know I'm kind of jammed through it. So, and I think we'll take questions at the end. And for pharmacies that are interested, they want to be on the wait list, they want to know more about it, the website is myvfcvaccines@cdph.ca.gov. And that's the California program located in Richmond. But there's also there's providers in the city of LA and the LA communities. So that's a different email address. So if you're a pharmacy located in that area, the email address is vaccinerec, REQ, @ph.lacounty.gov. Okay, but if you're not sure, if you're a pharmacy and you're not sure which area you're in, just email this one and we'll be able to filter it out. Okay. And again, we'll take questions at the end, but I want to turn it over next to Dr. Sherry Sherman. She's part of Element, and she's also a VFC provider. So I will turn it over to you. Okay.
All right. Thank you very much for having me here today. I guess there's not any pharmacies in the audience, but that's okay. My role is to follow John and try to give you a sense of what one pharmacy's experience has been with the VFC program, how we look at it, and how we've used those guidelines that John presented to be able to reach as many community members as possible, and also to make sure that when people think about pediatric immunization, that you do think of pharmacies as well as some of the more maybe traditional ways that pediatric patients get vaccinated, because I think that using the pharmacy in the community is a very viable way to help increase pediatric vaccination rates. So that's one of the reasons we got involved. Actually, what happened was a child walked into the pharmacy, and this child was covered by Medi-Cal, and we didn't know at the time, it was a long time ago, and we said, okay, fine, and you bill the vaccine to Medi-Cal, and you're like, what? What's that? The Medi-Cal's not paying for that vaccine for this child. What's going on? And then that's when we realized that vaccinating children who are covered by Medi-Cal is a whole other world than vaccinating other people. And of course, this was a while ago. So fast forward to, we worked with CDPH to become a vaccines for children provider. And so now we have a little bit of experience in that area. And I think that's why I'm talking to you today. As John said, the VFC program is exploring how pharmacy enrollment can assist with expansion of the VFC network in certain geographic area with a scarcity of VFC providers. And as we saw during COVID, pharmacies, especially the independent community pharmacies, have become very, very important depots for vaccinations, and I think actually surpassed most other entities in the number of vaccinations that we provide. And I know that the pilot provides really powerful and important data to identify needs and support the services required to ensure successful participation. And so very appreciative that CDPH is constantly looking for feedback in how the program is going. So basically, there are a lot of benefits to pharmacies to being part of the VFC program, in addition to knowing that you are helping to promote vaccinations and increase vaccination rates. As John mentioned, VFC vaccines are no-cost vaccines. And pharmacies are also entitled to a few fees that, kind of help the process, entitled to a professional consultation fee, entitled to a professional administration fee, entitled to a dispensing fee. So there are other, incentives. I mean, you have a staff, you have to pay them. I mean, that's kind of how life works. So it is great to be able to provide this valuable community service, but if you know any pharmacies or know anyone who's interested, please let them know that there are these fees involved, that the pharmacies do get paid. So there can be some benefit on multiple levels to want to get involved in the program. And then, in terms of like, well, what happens? What do we do? You just kind of put a shingle out and say, okay, I'm a VFC pharmacy, and then all of a sudden the kids start walking in. It's not really exactly how it works, but as a pharmacy, you have to figure out how to do that outreach no matter where you're located. So I will just tell you, for us, because this is one pharmacy's experience, we do partner with Los Angeles County Department of Public Health, and they refer a lot of mobile vaccination clinic opportunities to us. One of the primary ways that we are vaccinating is through mobile vaccination clinics. I would say that about 90% of our pediatric vaccines are provided through mobile clinics versus families just walking in the pharmacy. Of course, the walking in the pharmacy spikes when the local schools send out information right before school starts, but primarily we are out in many, many areas providing vaccines where the families are. And we have found that going to where the families are and where they're going to be for other functions, whether that's school functions or other functions, community events. That's the way that we have found that we can reach many families, including public and private school referrals. We just became contracted with LAUSD to be on their campuses. And so that's been really great for both of us. But even before that, we were vaccinating in private schools and charter schools. And, some people think that just because children go to private schools, that there isn't a need for VFC vaccines, but that's actually not true at all. Maybe you'd be surprised that, kids who are eligible for VFC vaccines actually can be found everywhere. As I said, community events, we work with lots of community event organizers who know to contact us. So whether that is a specific school event or whether it's a fair or whether it's being put on by even shelters or anywhere that kids can be, we will go anywhere for a mobile vaccination clinic. And in addition to that, we do work with some skilled nursing facilities that are pediatric focused. And the requirements to maintain a VFC providership are not totally easy. And believe it or not, there are some skilled nursing facilities who take care of pediatric patients who have given up their VFC providership just because of infection prevention nurse turnover and the difficulty in maintaining that providership. So there are even these inpatient facilities where the kids weren't getting vaccinated because the resource just wasn't there. And we also have partnered with clinics, doctor's offices to be there as the kids have their appointments. We have some vaccine clinics set up now. We partner with LA Care, and we have a series of vaccine clinics set up so that they have events at their community service centers, and we are there to provide vaccines. So just to get everybody thinking, it doesn't have to be the traditional way of somebody going to a pharmacy or a doctor's office. We can go to where they are, and that's become our model, actually. So key points about at least our experience about partners in the VFC program, like our pharmacy. Encouraging parents to bring all vaccination records when they see us, because of course we have access to the California Immunization Registry, but it's a good start, but there's a lot of limitations as well. Vaccines are only in the registry when they're administered in California. And we see many kids who are vaccinated in other states and other countries. So we have to decipher vaccine records from, putting many things together. So we always encourage parents to bring all vaccine records from whatever they have in their possession. Maybe it's the old yellow card, maybe it's printouts, maybe they have something on their phone, and then we compare everything. We have had to become familiar with reading vaccination records from other countries. Vaccine names and combinations can differ from the US, but some of them do translate. And so that's something that we've had to learn. Screening training, who's eligible for VFC vaccines, who's not eligible for VFC vaccines. Screening is a requirement of the program for every child that we see. So that's been a little bit of a training in what category they qualify under. And then it can, one thing that we've experienced is it can take a while with ordering and receiving VFC vaccines. So it's not like when you order something from your wholesaler and it's there tomorrow. So we have to plan ahead. And so you don't want to waste. So you don't want to order too many vaccines, but you don't want to get stuck, before August and not have enough Tdap vaccines. So that's a real balance to be able to kind of get that right. And so I really thank John's team because they work with us a lot, because we have to beg because a lot of times, we'll be asked to be at so many places and we'll go through all our Tdaps and it's, August. But we try to work with the schools and vaccinate earlier. But what we found is that it's not as urgent for a lot of families when it's this far ahead of next year. I mean, we're trying right now in the spring to work with schools to get the kids vaccinated for the next school year. But there's always a flurry of activity at the end of July and beginning of August and during the first couple days of school, because that's when it really hits home that the child won't actually be let in school. And one of the things that we try to get the word out on is that people can come to our location. We have extended hours, and most pharmacies have extended hours beyond what some of the doctor's offices and clinics offer. So we are, open on the weekends. We're open after 5 in the evening, and then also no appointment necessary. We've had kids who have come to the pharmacy, and we're told that at the clinic that they go to, that their appointment wouldn't be for a month. Or even more. And so we're trying to get the word out that we take a walk-in, so you don't have to wait and the kids don't have to miss any school. And that's really, really important, because that can become a stigma for the kids. Why aren't they going to school? And they can just come in, everybody gets a lollipop, and it's all good. Let's see. Let's go to the next slide. So in terms of Medi-Cal billing, so there's not a lot of pharmacies here. I won't spend a whole lot of time on this, but as I said, there is a vaccine initiation fee, there is a vaccine administration fee, and then there is a professional dispensing fee. So a pharmacy can, get $20 plus for administering a vaccine. And if you're seeing a child, we need 2 or 3 vaccines. That's a whole lot better than filling any other prescription, if you know anything about what happens in pharmacies these days. Of course, in addition to knowing that you're participating in something that's really, really important. Ordering pharmacist has to be enrolled in Medi-Cal as an ordering and rendering provider. So that's just some paperwork that has to be done, and the needs to have an individual, which is type 1 NPI number. And basically, if there was any pharmacists who were interested in the audience, maybe they would be interested in this slide. But there's just a little paperwork involved in becoming a VFC provider. As John mentioned, there are pharmacy requirements. You can't just pick up the phone and say, I want to be a VFC provider and send me the vaccines. So we do have to have a vaccine management plan in place, which includes a lot of items, including storage, and including emergency procedures and such. We have to have certain vaccine storage units, digital data loggers, temperature monitoring, procedures for potential temperature excursions, vaccine ordering and accountability, reporting waste and returns, and receiving vaccines and inventory management, eligibility screening, administration, reporting doses, and things like that. So it's not, it's not a walk in the park, but it is a very, very, very valuable way to engage more providers in vaccinating children. So that's just one pharmacy story. And if you have any questions, be happy to take those.
Can you talk a little bit about the screening process for whether someone's eligible, and then if they're not, the process to take?
Okay, yeah, so that's a very good question. So there are about 4 or 5 ways that, and I'm looking at John, so you can supplement me if I screw up here, but 4 or 5 ways that children can be eligible. There are 2 major categories that we see. One is a child that's covered by Medi-Cal or Medi-Cal managed care program is eligible for VFC vaccines, and a child who's uninsured. And there are a few other categories, American Indian descent, Alaska Native descent, a few others that we see rarely, but the 2 big categories are, as I said, covered by Medi-Cal or Medi-Cal managed care program, or uninsured. When we bring vaccines to a clinic or in the pharmacy as well, we always have both commercial and VFC vaccines. And that's a good question, because it's a question that we always get. It's like, what if the kid's not eligible for VFC vaccines? So we have commercial stock and we have VFC stock. Of course, those have to be kept separate, but we do always have those with us. So if a child does have commercial insurance, we can bill commercial insurance. We generally don't have issues with each, except one major sticking point, which we're trying to work through, which is Kaiser. When a family is has Kaiser insurance through a parent's work, Kaiser makes the kids go to Kaiser, and the outside providers cannot access that network. So that is one that tends to be an issue for us. Mhm.
There's also an age criteria.
Oh, yeah, yeah, sorry. Yeah. Through age 18. So that's another criteria. Yes.
Do you use my turn for charting?
We don't use my turn for charting. We report to care. Yeah, we use our EMR reports directly through to care through an intermediary. Yeah. So we use it's called Pioneer RX. I don't think anyone would be familiar with it. It's a pharmacy software and that reports directly to care.
Sherry, first of all, thank you so much for everything that you've done. You've been an incredible partner throughout COVID
you.
vaccine rollout and then expanding obviously to all the VFC work. I guess the question I had for you was, the VFC program was built on a model of kind of a provider office
Mm-hmm.
and a medical home kind of situation. So I'm curious, what were some of the biggest barriers that you faced when you started in the VFC program, and then
Mhm.
how did you overcome those
Mm-hmm.
with that kind of model in mind?
Right. So one of the biggest barriers is that just because you hang a shingle and you say I'm a VFC provider, people don't flood in. And so getting that word out that we are a VFC provider and we are here, it continues to be very difficult. Then I don't remember if we had the idea or somebody asked us to actually come to an event where, it was like a backpack giveaway or something like that for preschool, not preschool, but pre-semester. And that worked out so well. I mean, there were so many families that needed vaccines. We worked with Wendy Kate and we tried to figure out with her, well, how do we add this model to our offering to actually go where the families are. And that actually has become the major model for us. Oh. Right. Thank you.
So we're going to take a quick 15 or so minute break. If you need the restroom, there's a hallway that kind of snakes around to the left, directly behind this room. And there is food available for purchase if you need a coffee or any refreshments. And we'll try to get started just after 11. And also be sure to visit our exhibitors outside. The weather is yes, always. All right, friends, I think we're going to try to get started in just a moment. I know it's so hard to break away from these great conversations. Thank you so much. So I'm really happy to introduce our next speaker, Father Mark Menegatti. Father Mark Menegatti has ministered in the Archdiocese of Los Angeles for over 8 years and has been a Catholic priest for 13 years. He's a member of the Worldwide Order of St. Augustine and has served in the capacity as a high school educator, parish minister, and youth minister, and currently serves as a hospital chaplain. And Father Mark, as a true professional, will be presenting without slides, something I can't even imagine. So thank you so much for being here.
Well, thank you so much for the opportunity to be here. We kind of get an opportunity to shift for a moment to hear from the non-medical person, because one of the reasons we're here, or one of the things that's motivating many of us being here, is there's a lot of questions around childhood immunizations right now, and I want to maybe look at some of the verbiage, some of the language, some of the ethical principles, values, or broader perspectives that kind of go outside of just healthcare that are in alignment with what we do. And now as a full-time hospital chaplain, I work alongside a lot of healthcare workers, and so I work alongside a lot of people that I know are committed to saving kids' lives. As a member, as a clergy in this archdiocese, I was here during the shutdown, and it really felt like from between the archdiocese and LA Public Health, it was like Commissioner Gordon calling the Batcave every day. There was like a lot of communication. And I really valued that. I really valued that as a priest in this archdiocese, to have that much communication with public health. Here in this archdiocese, we have a long history, of course, with public health and with civic connections, but we do have a large school system. There's about over 250 schools in this archdiocese in LA County, Ventura County, and Santa Barbara County. That's the sort of reach. So that's about 67,000 students. And those students do get the standard track of immunizations that students do in regular public schools. Now, in terms of getting into a school or refusing to go into a school because of vaccination, I haven't heard that come up. I haven't heard that come up as an issue. So that has not been something that I've been in a conversation with. But it is a pretty standard thing that that might go unnoticed. In terms of how my church in this archdiocese works with public health, or works with the health and safety of children, and works pretty well. Now, my work right now is as an interfaith chaplain at a large pediatric hospital here in Los Angeles. I'm sure you can figure out which one that I'm speaking on behalf of the archdiocese. A major component of my work is a child has a new diagnosis or is going to go in for a life-saving medical procedure. And so the doctor who has diagnosed and seeing through the health of many of these children over and over and over again, carries a different confidence than perhaps the parent, who this is the very, very first time. Or when they're going through the procedure, again, the doctor has seen these successful procedures countless times, but the parent, it's the first time. So Dr. Shapiro did talk about listening. And so sometimes I'm one of those buffers as an interfaith chaplain, me or one of the members of my team, to stop and pause when we have a lot of families in the hospital. They say, I need a priest. And maybe what they mean when they need a priest is they need someone to listen with compassion. So we have a lot of nurses and a lot of social workers and a lot of other clinicians that also do listen with compassion. But I did want to stick with that image a little bit, because I've been in many scenarios where when the doctor arrives and they see me or they see one of the chaplains already with the family and helping the family, they feel a lot better that they're gonna. I'm having a dialogue with the family and they're having a dialogue with the family, and we're all kind of like in this together, and it feels like a really organic partnership. But we also think that there are times when the parents can be scared. And so I have an image that's kind of stuck with me over the years of being me when I was scared. I love to travel. Anybody love to travel? I love to travel. I love to go to train stations. I love to go to airports. I love to do that. I'm not crazy about road trips. I love to go in these big airports. And I tolerate all the inconveniences of going through the machines and, having my tickets ready. I tolerate that. I love getting on the airplane. I love flying. I love it all. I've flown on like hundreds of planes, but I've been scared on an airplane a few times. And I mean, even when I'm not scared on an airplane, I'm so boring and basic. I'm still going to pray when I'm on the airplane. But there was one specific time, and I was not on a very long flight. It was between Chicago and Philadelphia. And there was not a lot of people on this flight. This was like more than 10 years ago. It's like I've never seen planes fly with so few people nowadays. But there's not a lot of people on this flight. And it was late in the evening. And I do remember being on this airplane and being scared. And there was weather. It was, I think it was late October. So there was some kind of weather happening that maybe caused the plane to jolt a bit more than normal. And as I was scared, as I was clutching my rosary prayer beads, I noticed somewhere else across from me, by himself on a row of 3 seats, I noticed a pilot. Now, there's a lot of times where the pilot has been working through the day and then he has one more flight that he's going to go on as a passenger to get back to wherever he's going to go or his next assignment. And there was a pilot. And this flight is going bumping and up and down and rocking and rolling and roller coasting. And I'm scared and I'm clutching and praying. And the pilot was just calmly and serenely reading a book. Now, I want you to think of this pilot in your head. I want you to think of this calm, professional pilot he's not operating this airplane. He's relaxing on his way back, probably his way back home or wherever he's going to pick up on his next journey and leg of work, okay? I want you to think about him for a moment. So this pilot, maybe he's flown hundreds and hundreds of airplanes over his professional career. And that pilot has shared airplanes with other pilots. And that pilot knows that the airplane he's riding on and many of the airplanes he has flown has 500,000 pieces and nuts and bolts and wires. And when he's in that cockpit, there's all kinds of lights and meters, and I will never understand those. And he knows what they mean. He understands what those lights and meters and switches and buttons mean. And we in the healthcare industry, we have a very intricate system which is backed by years of experience, research, and peer review. Every time that airplane lands, it gets inspected. And it gets inspected many more times in addition to the regular inspections before and after flights. And there is so much that goes into the science of vaccines. And so the reason the pilot has some of this confidence is because of what he knows and what he understands. And so I hope that when we are aware of somebody who's like me, scared on the other side there, the parent or the family or the people that you are working with or the populations that are nervous about vaccines, that we are not too different from that pilot calmly riding in that airplane because we trust this process. And I got safely to my destination and many other destinations after this. I never met the pilot. I don't know his name, but kudos to him. And now in my faith tradition, without necessarily speaking in a lot of religious jargon, I thought I would draw upon some ideas and principles and language that would be, I think, crucial. Now, I mentioned that we have, and Dr. Shapiro talked in his first talk that, there's a lot of fears or there's different concerns. And I talked a little bit about compassion and listening to families or listening to people. And I mean, one thing that I did think about, well, I am, many of us, even if we do not have children, I do not have children. So I can't ever say to somebody who has a fear of immunization for children, I can't say that I would give these to my children. But that is something that actually goes a long way. But I can say that what I know and understand, I would share with my brother who has kids. I would share with or provide that information to families that I work with in the hospital. So that sort of transparency goes a long way in terms of trust. But in terms of some of the language that is beyond or outside of the medical field, in terms of ethics and values or broader perspectives, the church does use something called social teaching. And now social teaching, without necessarily needing to like go into a deep dive. I know you all would love to hear me talk for a few more hours. What I have to say is more satisfying than lunch, I'm sure. But just so these principles, there are 7 themes, and we don't need to go over all of them in details, but it's good to capture them. The first theme is always the dignity of the human person. And so that sort of like captures agency. It captures also the need for the populations we work with to feel safe and to have access to information. Dignity of the human person. Another principle is participation in community. So, I do work with some children who have severe comorbidities. And because of those comorbidities, parents have to wrangle very much with how much their child can participate. In order to have like a healthy whole life, we could be involved in things that enrich us. And, for some people, it might be church. For some people, it might be like a sports league, right? There are like a lot of communities, right, that sort of like that can enrich us. And so a principle of participation in social teaching is that it enriches us as individuals and it enriches society. And when I have kids who have comorbidities, there's a difficulty for them to be involved by enriching activities because of the risks of what many of us might take for granted. And having more children who are immunized, that helps vulnerable children. Another really important, another one of these, again, they're different principles. Another one of these principles is rights and responsibilities. These are, again, there are 7 themes, and these themes are tied together, rights and responsibilities. So if I am entitled to something by our society or by our government or by in some manner, if I have a right, well, there are people then others that become responsible for that. But in some way, well, even the individual citizens are responsible for other individual citizens. So like the responsibility just doesn't go to like the top of the pyramid. So the rights that I have are also become responsibilities that we all have sort of collectively. And so having a right also puts us in a position where, well, I need to take responsibility for my neighbor. And this is also, I'd say, in a manner, this broad religious principle, the golden rule, how it gets respected and how it gets described in the social teaching, the golden rule. And this is treat others as you want to be treated in a very, very general way, but in like a concrete way, how this gets described in social teaching is rights and responsibilities, and that these are connected to each other. And I'd say another one that this is a broad one that comes up a lot. I think in our modern age, in our connected world, we think about people who are suffering in other parts of the world. Solidarity, and this is also one of the themes of Catholic social teaching, solidarity, that we can think of, we can be aware of what other people are going through. So when we do think about immunizations and vaccinations, we're thinking of everyone. It becomes an opportunity. It becomes an opportunity to show solidarity by our concern for others, by taking or receiving or seeking out immunizations. And one other image that came up, I was in my own kind of like digging up images and analogies that a theologian from Fordham University, Michael Peppard, he did write an article. It's quite easy to find it online on Commonweal, August 2021. He was writing in about promoting access to COVID vaccination during that time. But I think he used a really good image, and his push was like, we need to keep thinking of like new analogies. And his image is traffic lights and intersections. So we do have in terms of access to childhood immunizations. Children sort of run around and play without abandon. And every parent I know is sort of having to make up the rules as they go along. And like the child is always like finding like a new danger, that they're always like exposed to a new danger the parent could have. There's nothing in any parent training manual. So this always happens. I always watch my brother or some of my friends who have kids. It's like I have to talk to them as they're doing this, watching their kids. And one of the things that is beautiful for kids being able to do that is that they're never going to be able to think about all the microorganisms. They can hardly think about, the choo-choo train they're about to trip on or slip on, or the Legos that they're going to step on. But the microorganisms that can cause them a risk, that's a lot to put on a child. And so it in terms of like setting up traffic lights, and then in terms of setting up traffic stops, the way city or an ordinance would go about these, or putting in speed bumps, or these sort of things. These address at a very local or precise level how it's important to be in cooperation with, you know, with the appropriate civic authorities to ensure safety. And so if we have immunizations that are recommended, that are understood as safe, it's similar to like needing to step in and figure out, well, we need traffic lights at these intersections. These ones are getting pretty busy. We need speed bumps here. We need, you know, this, we need to like realign how this, how these stops or yields in different things, and how traffic is managed. These microorganisms are going around, and we can't always see them. And this gives a much more public and transparent way to manage that. And so these some of my points. I'm so glad to have an opportunity to share with you the way that public health and Archdiocese has worked together. How we can be images of confidence and compassion for people who are scared, much like anybody who's in an airplane. We can be images of confidence and compassion because of what we stand on, what the history and what the research and what everything shows us. And we can also start to think creatively about some of the principles, the ethical principles, the values, the perspectives that can sort of underlie the common good that can unite us all or bring us all in safe ways to talk beyond or in broader ways than the medical terms. Thank you very much.
All right. We now have about an hour or so for some networking. I know there were a lot of great conversations going on earlier, so hopefully a lot of those can continue. We have our exhibitors outside. And then for those who are hungry for lunch, there's a small cafe just down the hallway to the right. Can't miss it. And other than that, I hope everyone, or at least most of you, will be able to stick around for our awards presentations at the end of the session around 12:45. So thank you. All right, we have just one more order of business. So thank you so much to those of you who managed to stick around. I know you may have Cinco de Mayo plans, and we will get you out of here just as soon as we've presented some really important awards. Before I get to the awards, though, I do want to make sure to give a huge thank you to Nikki Madrid and her team for helping to organize and make sure everything ran so smoothly today. Unfortunately, Irene Perobi, who really did all of the setup for this meeting before today, is no longer with Department of Public Health and has moved on to the Department of Mental Health, and we will really, really miss her. But Nikki and the rest of your team, thank you so much for everything that you've done today. So the last thing that we'll conclude with is the presentation of our inaugural Vaccine Provider of Excellence Awards. So these are awards that are given to either individual providers or others in the immunization space, or organizations who demonstrate an effort as an immunization champion with outstanding leadership, dedication, and advancing immunization efforts. But I will say that little snippet really doesn't even begin to capture the work of our two awardees. So I will start with Dr. Ishani Dige. She unfortunately was not able to be here today. She's at a conference, I believe in Northern California, but just a little bit from her nominator. The project that she's being recognized for is growing inpatient pediatric influenza vaccination rates at Harbor UCLA Medical Center. And her nominators write, since beginning at Harbor UCLA last August, Dr. Dige has demonstrated exceptional leadership and initiative in improving inpatient pediatric influenza vaccination rates. She proactively obtained and analyzed data on historic flu vaccine administration in our unit to identify gaps and guide targeted interventions. She partnered with physician and nursing leaders to expand education efforts, created clear and effective infographics for residents and nursing workspaces, and actively sought nursing champions to build unit-level buy-in. She also updated the daily physician nurse briefing tool to include influenza vaccination and as a consistent checkpoint in patient care. And as time has gone on and influenza vaccine rates have increased, she has created new infographics to target ongoing gaps in nurse and resident education and knowledge as it relates to the flu vaccine. As a direct result of these coordinated efforts, inpatient pediatric vaccination rates have increased by 3.5-fold, which is just enormous. So really outstanding outcomes, and huge congratulations to Dr. Ishani Dige. And she will receive a lovely. And last but certainly not least, our institutional or organizational level award is going to Elements Pharmacy. Elements is an independent community pharmacy in Studio City, and they're being recognized for leveraging partnerships to bring vaccine access to communities in need. So we did hear a little bit about Elements earlier, but I will just read from the nomination as well. So Elements focus on underserved populations, from children in under-resourced communities and residents in long-term care to unhoused individuals reached through street medicine collaboration. Reflects personal and professional commitment to health equity that far exceeds regulatory requirements or reimbursement incentives. Elements has maintained long-standing and trusted partnerships with health plans, health departments, long-term care facilities, and community organizations. Elements also provides access to state general fund flu vaccines and 317 funded hepatitis A vaccines, and is a VFC provider. The aggregate result is more than 150,000 vaccines administered annually, which is a number I can't even really begin to imagine. So I believe Sherry Sherman will be accepting the award on behalf of her pharmacy. Thank you so much, Sherry.
Thank you so much.
And then I did also just want to quickly mention the members of the award selection committee, all from DPH. So Julia Heinzerling, Gina Johnson, who is actually one of our ICLAC board members, Laurel Fowler, and Irene Perobi. So thank you all for your service. And thank you all for being here. I know we had just a few of you hang on till the end, but really good key group. And I think this was a great meeting. So now please go forth and have some tequila tacos. And hopefully the traffic isn't too bad. So thank you all.